Impoverished rural populations relocate to urban areas to find employment. The wave of urbanization hits developing countries particularly hard. During the period from 2000 to 2030, urban populations will double, the majority of newcomers being poor people. Unable to obtain formal employment, they struggle to maintain their livelihood. People are too poor to own land, which leads to the expansion of illegal settlements. The poor living environment in these areas contributes to further destitution. These areas have very limited access to drinking water and sewage systems, social services such as education or medical insurance. In such difficult circumstances, people have few safeguards or protection. Urbanization began early in the Republic of Zambia, a landlocked nation in southern Africa, in contrast to other countries in sub-Saharan Africa. Copper, which is Zambia's main export, began to be mined at the end of the 1920s. Cities began to grow around the copper mines, and urban growth also followed the railroad lines transporting the copper out of the country's northwest region. With the development of a monetary economy, cities began to expand, and people seeking cash income flocked to these centers from rural areas. This population explosion was most pronounced in the city of Lusaka, the capital of Zambia, where the population increased more than 10 times in less than 40 years, to 1.7 million today. Finally, large numbers of people flowed into the newly emerging cities seeking work. But many were unable to find work. The situation was made worse by rapid price increases that led to a huge increase in the number of poor people who today make up nearly half of the entire population of Lusaka. Compounds. These are unplanned residential districts where large numbers of the poor live. New arrivals settle here without government permission, and their numbers continue to increase each year. Currently, some 1 million people live in 24 different compounds, a figure which has doubled in 10 years. Since these areas are not included in urban planning, basic infrastructure remains undeveloped. People are forced to live in unsanitary conditions.
We had a lot of problems in the compounds that they started working in terms of not having enough water supply. We had improper toilets being used, and the garbage, in terms of how people were disposing of it, was very poor. And we did also experience cholera cases in these compounds during those periods before the project came in. I think because of the lack of clean water and the habits of how to make the water safe.
They draw their domestic water from shallow wells. The water had a high risk of contamination and has caused mass cholera epidemics in the past. Deteriorating sanitary conditions, compounded by poverty, threaten the lives of young children, and the mortality rate for under fives was more than 15%. The main causes of death were diarrhea and malnutrition. Inadequate basic infrastructure and the lack of parental knowledge about health and hygiene exacerbated large numbers of unnecessary child deaths. Infectious diseases stemming from an unsanitary environment and the hazards that threaten the lives of young children. Inhabitants in the compounds face a variety of fears. They suffer from the lack of safe water, nutrition, and healthcare services needed to maintain good health. Government services to safeguard the lives and livelihoods of its citizens were inadequate because of limited national finances. People living in the compounds face not only economic poverty, but a variety of other threats as well. There was an urgent need for a human security-based response, focusing on the socially vulnerable. The concept of human security is designed to address these problems by empowering people and local communities to participate fully in health, social, and economic activities designed to enhance their well-being and safety. These problems are often interlinked. Rather than respond to each problem individually, comprehensive action must be taken against a variety of problems to prevent conditions from deteriorating further. It is not enough for the government to provide needed services to protect its people. It is important that local communities actively embrace these activities. This will enable people to solve their own problems and give them the ability to improve the quality of their lives. Therefore, JICA believes that a joint approach that includes both the government and local communities will make it possible to achieve assistance that reaches the people and produces sustainable results. Furthermore, we want to place a focus on vulnerable people in society and people facing issues relating to life and death, standards of living, and personal dignity. Over a period of time, sustainable results will lead to stable local communities. The George Compound, located in George District in the northwest area of Lusaka. 130,000 people live in poverty in a narrow area of approximately 4.8 square kilometers. Dwellings are packed closely together, and sanitary conditions are poor. Cholera epidemics occur during the rainy season. Access to safe drinking water is essential in order to prevent the spread of infectious diseases. Therefore, the Japanese government built a water supply facility in the George District, funded by grant aid. However, this facility alone has not been enough to raise the health of citizens to adequate levels. Mr. Sasaki, who worked as an expert in environmental health, recalls conditions at the time.
インフラストラクチャーが整ったとしても、そのエンドユーザーと言われる地域住民のエンドユーザーの方々が適切にその安全な水を摂取する、また安全な水を用いるということがない限り、基盤とその人々これをリンクさせない限り、相乗効果がもたらされないという現状がありまして、そういう地域にあってはその地域住民自らが自分たちの健康を守るというその、住民参加が非常に重要になってくるということで、このプライマリーヘルスケアを導入いたしました。
In this approach, community residents take the initiative to safeguard their own health. Instead of relying on medical services that focus on treatment, primary healthcare activities focus on disease prevention and strengthening the initiative and capacities of the community. In order to stop epidemics such as cholera, the entire community must be involved in efforts to improve environmental health. To improve the health of infants and young children, health education must be provided for the parents and caretakers responsible for raising the children. Implementing primary healthcare measures is useful in compounds, which lack access to adequate health and medical services. That is why JICA started the Lusaka Primary Healthcare Project in George District. It was a new attempt to create a model for urban primary healthcare.
特にこの都市貧困地域での成功事例というのは今までなかったもので、そういう意味では開始当初はいろいろ暗中模索をしながら取り組んだんですけども、その中で特に深刻な問題として抱えている環境衛生、安全な水とか衛生の部分、それを住民の方々が自分たちで地域の問題を分析をしてですね、で実際に実施をして評価をするというこの一連のこのプロセスを全部住民参加、住民主導でやっていくというのがこのファストの意義になっております。
Residents are responsible for analyzing the problems and efforts to improve environmental health. In this project, the FAST approach was adopted in response to actual conditions in the compounds. Volunteers were recruited from among residents and environmental health workshops were held. Audiovisual materials were used in the workshops to enable easy learning.
What else can you see on this? The man vomiting. All right. So using these 4 pictures, I want you to come up with a circle, a vicious circle.
Then, an environmental health committee was established, consisting mainly of community volunteers. The committee discussed measures to prevent cholera and began tackling problems, starting with the most serious.
The purpose of cleaning and constructing drainages is due to this area is waterlogged. So hence, when if there are no drainages, there's a collection of water. Sometimes even water goes in houses. Hence, to bring diseases like dysentery, diarrhea, cholera, and all those things.
In addition to digging a drainage ditch, volunteers participated in activities such as constructing ventilated toilets and holding trash collection activities. A hazardous, unsanitary environment was steadily improved through the efforts of the community residents themselves. Another aspect of FAST activities is that each volunteer visits every home within the community and provides advice on cholera prevention measures. The persistent efforts of volunteers brought about a change in the awareness and behavior of community members. Disease prevention and lifestyle habits, such as boiling drinking water and washing hands using soap, started to take root. Thanks to these efforts, the number of deaths due to cholera fell from 70 people out of 10,000 in 1994, before the start of these activities, to only 1 person in the year 2000. However, other problems remained in George District that needed to be resolved.
There were some parents who would have been able to take some preventive measures, but I think most people were not sensitized on what they should do if children got sick and they were still at home before they reached the health center. So most of them would probably just wait and watch the child. And in children, that can be very dangerous.
私たちが一緒に働いてたルサカディストリクトの保健行政の組織はどちらかというと医療施設での医療サービスを中心に行政の活動をしてたんですけども、このように地域の中に入って地域のお母さん方また家族が予防活動、予防により重点を置くことによって病気とかを減らしましょうというような活動はそんなになされてなかったんですね。
In one section of the George District, the body weight of children under 5 years of age was measured. GMP Plus is a comprehensive growth monitoring program for infants and small children. Its aims are to prevent disease and promote health, and it is a focal program together with FAST. In addition to measuring the body weight of children, GMP Plus provided counseling for parents with children suffering from malnutrition. By listening to their lifestyle habits, they provided advice on preventing diarrhea and introducing babies to solid foods. Actually, almost all of the people working here are volunteers from the community. Through training provided by the project, they acquired knowledge about health and hygiene. They provide community residents with services they need at nearby locations.
We also monitored how the nutrition status was by training community volunteers to do nutrition counseling. So once they found a child who was a danger of getting malnourished, they were able to counsel, talk to the mothers and give them some ideas of what foods they needed to give the child and how they should prepare these foods so that the children do not go into severe malnutrition.
GMP Plus also provides vitamin A and community-wide vaccinations by visiting health center employees. When malnutrition is recognized, the child is transported to a medical facility where appropriate treatment is available. Government health organizations and community volunteers work closely together to protect the lives of young children.
The most exciting part within the exercise itself is when we identify a child whose parents need to be counseled. I think that is the most exciting part because now you have that face-to-face with the parent and try to advise and encourage how to go about it so that this child may improve in the health status.
So that's why
An average of more than 4,000 parents with children participated in GMP Plus per month. As a result, the ratio of infants and young children with low body weight decreased from 23% to 15%. Most important of all, the concept of primary health care, to be responsible for safeguarding your own health, has begun to take root among residents. Based on the FAST approach, activities to improve environmental health through participation by residents were implemented, as were, through GMP Plus, comprehensive activities to monitor the growth of infants and young children. By combining these two approaches, a model for urban primary health care was created. These activities represented the real implementation of human security. Helping poor people facing health problems to help themselves. This was what gave hope to the people of George District.
Lusaka DHMT was very happy with the results of phase 1 in George, and we thought because of that good achievement, it wasn't good to keep back the good work that was going on in George from the other residents of Lusaka.
ジョージだけではなくて、ルサカ市には他にも貧困居住区、未計画居住区がございまして、その中でもより衛生状況の悪い、また子どもの健康状況の悪い地域を選択いたしまして、そこに対して活動を拡大をしていきましょうというふうになりました。
Based on its experience in George District, JICA expanded its activities to 6 other compounds in Lusaka. All of these communities had high rates of population growth, with many residents living in poverty. In Phase 2, using the FAST and GMP Plus approaches, the scope of primary health care was broadened. For example, GMP Plus was held every month in approximately 80 different communities, and volunteers followed up with visits to households that did not participate in the program. Approximately 1.8 million infants and young children participated in GMP Plus during a 10-year period. Access to health services greatly improved. And the ratio of infants and children with low body weight decreased to 10% from 15% before the project began. Cases of bloody diarrhea in children fell dramatically from 26 cases per 1,000 children to 6 cases. For FAST activities, a total of more than 300 volunteers from 6 communities were educated. In addition to constructing facilities such as drainage ditches, the volunteers visited a total of 50,000 households individually to disseminate cholera prevention measures. Each resident is trying to acquire the knowledge to deal with the threat of a cholera outbreak, which could occur at any time in their daily life. During Phase 2, the focus was also placed on strengthening government capacity and community organizations. Government plays an important role in firmly establishing GMP Plus and FAST volunteer-based health activities. Therefore, the project was carried out in close cooperation with the Lusaka municipal government to strengthen its capacity. GMP Plus monitoring is performed by the City of Lusaka and each health center. Volunteer activities are evaluated by health center staff members, and volunteers are given the opportunity to develop support measures independently.
I think they know what they are doing. We have to look at the records to see how they are keeping the same records they're collecting. So I think it went on well. It's okay.
Instructor training is being held for the employees of each health center. Employees are responsible for training community volunteers in each district. More than 800 volunteers have been trained who have gone on to become supporters of health activities. Future supporters are created in this way. The volunteers of each community are the key to establishing the primary healthcare program. Raising their motivation and developing their self-reliance were the major issues in Phase 2. The project provided technical and organizational support for businesses, which in turn generated funds to help volunteer activities. Currently, businesses have been established in 4 areas, including public pay toilets and producing corn flour, a national staple food. Among these activities, the milling business of the Ngome district is particularly profitable. A portion of the profits are returned to the volunteers in that region. Government support of top-down activities. Income generated by bottom-up activities of resident organizations. These factors energized volunteer activities and firmly established primary health care.
From the experience we've had with the JICA partners and the JICA PHC project, I think it's the way they want the beneficiaries of the effort to participate, and therefore they recognize the value of the work that is going to be put in.
ザンビアの人たちの長い歴史の中で彼らもそういう相互扶助という意識をもともと持っているんですね。でその彼らの持っている伝統的な大切なその相互扶助という考えと、またそのプライマリーヘルスケアというその健康保険の意味での相互扶助という部分をうまく重ね合わせながら彼らの中のその力を引き出したという ところに私はこのプライマリーヘルスケアのプロジェクトさまざまな形で成果を示すことができた背景があるんじゃないかなというふうに思ってます。
Even and then maybe leave it in the area of technical assistance. The implementation is left to the hands of the local people. So I think that's a very strong attribute because the skills are passed on.
Today, GMP Plus will be held in the Chawama district. Volunteers are calling for the participation of as many people as possible. A long line of children waiting their turn to be weighed. The number of participants easily exceeds 100 people. This is Boniface's 4th year as a volunteer. He has learned much and has gained confidence in giving advice on health issues.
But after some time, I came to realize that what I'm doing is very good. It also assists the community because you come from the community and you have to work in the community.
Zikomo kuri bantu baja and bantu baja timafuna in the future bazibapasako kangono because basebenza maningi because population yabana ndiye future yabo.
A cooking demonstration using soybeans is being held in one section of the venue, providing children with foods high in nutritional value. This has been firmly instilled by the GMP Plus program. Through the support of the government and other relevant parties who encouraged community residents to take the lead, the assistance project reached many people and contributed to achieving sustainable activities. You are responsible for protecting your own health. This shared perception fosters communal solidarity. Today, there is a sense of community in the compounds that continues to spread.